the left hypochondriac region. It is related between 9 to 11 ribs. Okay, and the dimensions of the spleen are 1, 3, 5, 7, 9, 11, which is 1 inch thick, 3 inches broad, 5 inches long, 7 ounces in weight, and related between 9 to 11 ribs. Okay. Now, when you talk about external features of the spleen has two ends. See, this broad end is the anterior end. Anterior end looks like a border. It is not pointed. The posterior end is pointed. So there are two ends. The anterior end is pointed. The other peculiarity of the anterior end is that it comes in the mid-axillary line. That is the second peculiarity. So there are two ends, two surfaces. This surface is the diaphragmatic surface. The other surface which is there inside, this is the visceral surface. There are three borders: the upper border, the superior border, this is the intermediate border, and this is the inferior border. The superior border is characteristically notched. You can see a notch here at the anterior end, which is representing lobulation of spleen during fetal life. Okay, so this is how you identify the superior border. It should have a notch, and that notch should be towards the anterior. Okay, but the other things with peritoneal relation, the three important ligaments which are attached to the spleen are gastrosplenic ligament, lienorenal ligament. Gastrosplenic ligament is going to connect the fundus of the stomach to the spleen. Lienorenal ligament will connect left kidney and spleen, and phrenicocholic ligament is not directly attached to the spleen. It is attached to the phrenic diaphragm and to the colon, the splenic flexure of colon, and it supports the anterior end of the spleen. So that is the peculiarity of phrenicocholic ligament, that it is not attached to the spleen, but it supports the anterior end of the spleen. Then the visceral relations are between the superior border and the intermediate border. You have gastric impression for fundus of the stomach. Between the intermediate and inferior border, you have renal impression for upper pole of left kidney. At the anterior end, you will have the colic impression for splenic flexure of colon. And at the intermediate border, you can see the small, this is the pancreatic impression for the tail of the pancreas. The intermediate border has the hilum of the spleen, through which splenic artery and splenic vein are going to enter the hilum. Thank you.